And she's described it like a switch flips, because when she comes out of it, it's like she can wake up one day and just tell that it's over. It's like, oh, I'm back in my normal mind again. And it really feels like it's just switch to one side, boom, switch back to the other.
Hey everybody, before we start the show, I want to make a couple disclaimers. This show does cover a wide variety of topics related to mental health and life in general, and some of those could be sensitive for you. I want to simultaneously encourage you to be brave in consuming difficult content, but also respect and recognize your limitations. So please use your best judgment. I will never be offended if you need to skip a question or an episode entirely, but feel free to feel it out, check out the episode, and just see what happens. If you need to skip, that's okay, but feel free to give it a shot first. I also need to say that while I am a psychologist, I'm not your psychologist, and I'm not your therapist. This is not intended to be direct medical advice, and you should not use this as a substitute for professional help. So with those said, let's go ahead and get into the show.
All right. Hello, friends of all varieties. This is the Hardcore Self-Help Podcast, episode 362. I'm your host, Dr. Robert Duff, aka Duff the Psych. I make mental health content for real people just like you. And today I have a question and answer episode. 2 awesome questions from listeners like yourselves. If you would like to send me in a question for the show, please send me an email to duffthepsych@gmail.com or use my contact form on the website, duffthepsych.com. The website is still a work in progress. I have gotten good feedback from you guys about things that are missing and such. I need to reinstate the search bar. I need to put back in some old posts, things of that sort, resources that I said were on the website, which have gotten lost in the shuffle. So continue to let me know if you don't find something that you're looking for, but just know that there's a lot of stuff that's on the to-do list with that. It's a matter of, just putting in some time and coordinating with other people, obtaining passwords, all sorts of stuff like that. So, a big pain in the ass, but it's necessary and well worth it because I want to make sure that this is functioning well for you guys. I also want to thank all of you who sent in feedback about the podcast. Very helpful. I've been trying to adjust things here and there. And as for now, no significant changes to the format of the podcast. It seems like most people enjoy the way it is right now. But I am going to be adjusting sort of my promotional side of things on social media, etc. I will be getting around to my email list again soon. And also just reminding myself that there's a lot of amazing one-on-one individual feedback that I've gotten. And even if the show got 0 listens, somebody letting me know it impacted their life would be well worth it. So that's awesome. That said, let's just go ahead and jump into the questions. Here's the first one. Hello, Dr. Duff. I recently found your podcast and it's been very helpful, especially the episodes on anxiety and stress. Thank you ahead of time for the awesome work you've already done and looking forward to listening to more episodes in the future. Here's my question. As with many, I've struggled with pandemic-induced anxiety and depression and have been trying to address it through therapy. My anxiety has greatly improved. However, depression continues to be a cyclical problem for me. It comes crashing as a wave of sadness, low self-esteem, and irritability a few days before my period when my body's hormones are gearing up. I've recently heard about PMDD, premenstrual dysphoric disorder, and I'm wondering if this is to blame. Basically, 2 to 3 days before I get my period, I get an overwhelming sense of despair, helplessness, numbness, and sometimes anger, which dominates my thoughts for a few days and goes away shortly after, almost like it never happened. I was unable to find any conclusive information as to who I should talk to with this, GP, therapist, psychiatrist, OBGYN, etc., especially since it seems not all doctors believe it's real. Any advice on the topic is much appreciated. And then she goes on to say, I appreciate even just the space you're providing and allowing anyone to send in an email. I'm sure I'm not the only one who feels seen by the hand you extend through your platform. Looking forward to listening to upcoming episodes. Thank you for the praise. Really, really appreciate that. And thank you for the question. I'm super happy that you brought this up. Interestingly, for one reason or another, the topic of PMDD, so premenstrual dysphoric disorder, and other, cycle-related mental health fluctuations has come up frequently lately. It's come up quite a bit. I'm talking about loved ones of my own, patients that I work with, and just general discourse that I've seen out there on social media, etc. So I'm happy to talk about it. I'm really proud of you as well for getting some therapy to deal with the depression and anxiety. You're right that a lot of people have had mental health issues that were either prompted by the pandemic or exacerbated by it, worsened by it. What I've seen most often is that the additional stress of the pandemic, whether for health reasons, economic issues, or whatever reason, has pushed people to the point that their normal coping skills, their normal adaptations are insufficient and they break down. So now they're in a place where their anxiety, depression, what have you, is actually interfering with their ability to successfully live life. So that's what I see most often. Not that, somebody had no problems prior to the pandemic, but just that they had things under control and the pandemic pushed them to that point where it's not working as well anymore. But for you, it's awesome that you've been able to get some help, get some therapy, and it sounds like you've been able to make a serious dent in how much anxiety is impacting you day to day. But what I hear you saying is that you're struggling with these crashing waves of depression symptoms, things like sadness, irritability, and it tends to correspond with the premenstrual phase of your cycle before you get your period. You mentioned that you haven't been able to find information about this, so I assume, and actually I know already, that other people are in the same boat, so really glad to have the opportunity to speak about it. Now, please keep in mind, I do not have a uterus, so I can't completely empathize with the experience or speak from my own experience, but I have witnessed it very closely. My girlfriend actually has severe PMDD, and she gave me permission to talk about her in responding to you. I let her know that I got this question and she wanted to be able to contribute. So, it's remarkable how much of a difference it makes, how much of a change there is with PMDD for her in particular. And she's somebody who tracks her cycle on an app, so she's really been able to narrow down that window like you have, where it's like, a matter of days leading up to the period, and you can really tell there's a behavioral shift during that time. For her, it's typically a little bit longer in duration than what you talked about, but in that period of time, her behavior, her emotional state can drastically change. And I can often from the outside tell when it's happening, at least I can now, because it feels like I'm talking to a different person. You get irritation, anxiety, hopelessness, and the level of overwhelm, it just goes through the roof. And she's described it like a switch flips, because when she comes out of it, it's like she can wake up one day and just tell that it's over. It's like, oh, I'm back in my normal mind again. And it really feels like it's just switch to one side, boom, switch back to the other. And as I mentioned, I have patients that I work with in therapy who have realized that they deal with similar experiences. And when I've shared that flip switching metaphor with them, it's really rang true. I've kind of shared that, some people say it feels like you're flipping a switch, and they're like, yes, that's exactly right. Now, even my wife, and for anybody who is confused by that, yes, I have a wife and a girlfriend, polyamorous, yada, yada. So even my wife, who has had uterine ablation, so meaning they go in and they, well, I guess I don't really exactly know what they do. They burn or scrape things out. Basically, they mess with the uterine lining so you don't have periods. So she has uterine ablation. She also has tubal ligation, so she got her tubes tied. And so she doesn't get a period, in the normal sense, but you can still see the hormonal fluctuations, right? So she hasn't had everything removed, so she still has that cycle, but she just doesn't have a period from it. So even with that, you can tell there are some differences depending on where in her cycle she probably is. So yeah, PMDD is a real thing. And I would argue that it's not up for debate. It's a recognized issue. And if there's a doctor that doesn't believe in it, yeah, that's a problem. But of course, we have a shitty track record in the field of, broadly medicine with recognizing, women's issues and, broadly people who have uteruses. But if you even think of the term hysteria, the root of that, hysteria, I don't know, say hystos, whatever the root of that is, it means, the womb, like getting a hysterectomy, right? And so it's essentially a term that was coined to mean, madness that it happens for people with uteruses because, they have the madness of the womb. So yeah, we suck at this stuff. And so some of that lingers in the way that, providers think about these types of issues. So I'm sorry if you've run into that in your life so far, but no, it's a real thing. PMDD is absolutely real. And, even if doctors do understand that it's real, a lot of them aren't as open to considering it as a primary issue. Again, speaking about my girlfriend here, she's only recently been able to get providers that recognize it's a significant issue beyond her normal mental health concerns, right? So she already has some stuff she's coming in with, and it's only now that she's getting people who are like, yeah, this is a separate diagnosis. It's something on top of everything else, and that requires addressing, that requires treatment. To answer your question about who to talk with about this, I would say the answer is probably whoever takes you seriously and hears you out. In speaking with her OB, my girlfriend didn't really get anywhere, at least the one that she had at that time. Her OB basically told her to make some lifestyle changes, change your diet, and then also at a certain point placed her on hormonal birth control, which can be a strategy in some cases. But for her, it actually made it so much worse. It became much more severe, and she really felt like she lost a lot of control during that period, and so she went off of it. Eventually, she was able to find a program through UCLA here in California, and it's a clinic called the Women's Life Center. And I know that other large networks like, say, USC or Cedars-Sinai, these are all Southern California ones, they all have similar programs. And specifically, they're programs for pregnancy-associated psychiatric conditions like postpartum depression or anxiety, PMDD like we're talking about here, or even perimenopausal health issues for people going through perimenopause. So very specific for this type of issue. And it's a really amazing program that she's been able to get into. She had a 1.5 hour intake to start off with, and they were very clearly able to state, yeah, you have PMDD. And so the strategy that they're employing right now is they have her on an SSRI antidepressant, so something like Prozac or Lexapro. They have her on one of those in addition to her other medications. And basically this is used when she's having issues with PMDD. So at the first signs of mood change associated with her cycle, then she'll start taking the medication. And that, again, that's on top of the other medications that she normally takes. And then when she gets her period and things, that switch flips back, then she stops taking it. And so far, we are in the second cycle of that, actually in the midst of it at this very moment. And it really, really does seem to be helping. Things are still different. Things are still elevated, stronger emotions, things like that. But the helplessness, the irritability, the kind of really difficult emotions to cope with, those are a lot less severe. So that's a huge lifestyle benefit right there. So that's one way of doing it. Again, through this clinic, they decided to go that route. It may change over time, but at least they are taking it seriously and trying to do something about it. Now, I'll continue talking about, sort of where to go from here for you. But before that, we need to take a quick break and talk about our sponsor. Okay, this episode is brought to you by BetterHelp. This is a really good sponsor for this episode since we're talking about getting help, getting perspective on things, especially through therapy. We don't always know what to do in life. We don't always have a clear path ahead of us. We don't always know if our thinking is on track or if there's something else that we should be considering. So whether you're dealing with healthcare decisions, decisions around your career, relationships, anything else, therapy helps you stay connected to what you really want while you navigate life. So if you're interested in pursuing that, you should check out BetterHelp. BetterHelp is an online platform for therapy. It's entirely online. It's designed to be convenient, flexible, and suited to your schedule. You fill out a brief questionnaire, and that will help you get matched to a licensed therapist quickly. And importantly, you can switch therapists at any time for no additional charge. So, for instance, like the person in this question, if they were with somebody who maybe didn't quite understand the PMDD aspect of things so much, they can easily switch to another therapist that might be better at that. So let therapy be your map with BetterHelp. Go to betterhelp.com/Duff today to get 10% off your first month. That's BetterHelp, HELP.com/Duff for 10% off your first month. Okay, so back to the question here. Obviously, being in the greater LA area like I am, there are a lot of resources here. And for you, depending on where you live, you may or may not have these kind of similar programs and clinics around you. But regardless, definitely do some searching because you deserve to get appropriate care for this, and it's getting in the way of your life, and you deserve to have some relief from that. I would say that an OB or a psychiatrist that focuses on issues like this would be appropriate for managing the physical and medication portion of treatment. And this is also something that you could definitely talk about with your therapist as well, kind of the two together. From the therapy perspective, I see a couple potential benefits. For one, your therapist can keep in mind the PMDD when interpreting your behavior. This is something that I keep in mind with my therapy patients that get periods. Sometimes they'll talk about, how they're feeling so agitated or dysphoric or ragey. And I ask about, where are they in their cycle? And sometimes when I bring that up, they go, oh, yeah, that's probably it. That probably is playing a huge role, right? Not always. And, from my side as a therapist and as a man, I try to do this, very respectfully and tentatively, like, hey, don't mean to minimize what you're talking about, but I do want to ask, just out of curiosity, could this be related to your cycle at all? Something like that, trying to not just like blame it on, that. But many times it actually is. So definitely that's something that your therapist can keep in mind and sort of keep an eye out for. And then also together with your therapist, you can probably develop some strategies that help you adjust as needed to the symptoms that may pop up during PMDD. So, for instance, if you need to reduce your commitments that you have going on, or conversely, if you need to increase the amount of people and socialization that you have during that period of time, you can figure that out together and come up with a plan or a strategy. And then, of course, there are also just general coping skills that you can work on together, which I'm not going to dive into since you already have a therapist. You've already done a ton of good work on this front. So you get the idea. And the last thing I'll mention with therapy is that I have found the premenstrual period can sometimes present an interesting opportunity. In particular, I mean opportunity for depth. Now, obviously, it can be inconvenient, painful, sometimes even scary to have such strong feelings when you're in the midst of PMDD, so I don't want to minimize that. But you might also have the chance to access some deeper feelings that you would otherwise avoid or just wouldn't realize that you have. Stuff that's, kind of deeper down, more deep-seated. Sometimes this bubbles up to the surface when you are less defended, when you're less, with your guard up during the PMDD phase of your cycle. So, that's something that can be used there. And this is something that I've tried to do with people in therapy. Even if we can recognize that their feelings are going to change once they progress in their cycle and have their period, there may be some emotional pay dirt that we can access during PMDD. And so, with a therapist, it's awesome because if you uncover some stuff during that raw period, you can return back to it later on. You can return to the topics or feelings that emerge after the period happens and approach them from a different perspective, maybe a little bit more rational, maybe a little bit more in your head versus just in your body and pure emotion. So those are some things that you can do to benefit from therapy during this process. I also think that talking with loved ones in your life could also be beneficial. My advice here is similar to a lot of my responses on the show, which is you have the right to share this or not. It's your own personal health information. But the knowledge of, what goes on with PMDD for you in particular, it can help others be better toward you, and it can help them understand how to interpret your words and behaviors. So bringing it back to the personal, for me, with my girlfriend, I might assume that she's mad at me or feeling less love or care toward me because, every time she has PMDD, that is something that I could pull from it if I'm not interpreting it the right way. But I now know that that's not the case. We've clarified that. I know that that's just what happens. So instead, when I see my words being taken very literally or her responses to things I say becoming more short and clipped, I start to consider whether PMDD may be kicking in. And on my side, that means I make an effort not to push too hard. Everything can be addressed in time if needed. And for me, I've had to learn that it's important to ignore my sense of urgency that can come up. And that sense of urgency can lie to me and say, hey, you need to fix this right now. And instead, being more patient and softer is necessary. I'm not perfect. I don't get this right all the time, but I try to adjust the best I can, and I'm learning as we go on. So, in summary, I want you to know that you're not making it up. You're not being dramatic. PMDD is real. It's a real issue that many people have, and it's worth getting help with it. It's worth getting appropriate treatment. Start with whatever provider you have a good existing relationship with and go from there. Ideally, you're going to want somebody on the medical side, like a psychiatrist and or an OB, and as well your therapist. It can be your existing one, or you can find somebody else that specializes in these issues. But I want to reassure you, you're not doing anything wrong. Truthfully, I think that you should be able to make whatever accommodations you need for your cycle, right? I wish that you could take time off or, set aside time for processing where you don't have other burdens on you. But unfortunately, we live in a capitalist society constructed by men, and so you don't really have that opportunity. But I do hope that you can find providers that take you seriously and find a way to, work toward life that's more comfortable for you and a little bit more under your control and in your wheelhouse. So thank you for the really thoughtful question. I appreciate it. All right, before we get into the second question, I'd like to talk about our other sponsor. This episode is also brought to you by OneSkin. They are back as a sponsor, and I have not stopped using their products since I had them on the show previously. They sent me the OS1 Face and OS1 Eye, so an eye cream and a face cream, and they're perfect for me. I try to take good care of my face, my hygiene, my body in general, but I really require things that are simple and easy to use, and that's definitely the case with OneSkin. It's just 2 little pumps. They're both refillable. I use one on my face, one on my eyes in the morning and night, and I don't think my skin has ever been healthier looking. OneSkin is really interesting because they're founded by a team of 4 PhD level longevity scientists. So they've actually done research studies to understand how and why OneSkin works. OneSkin works by targeting the main source of skin aging, which is the buildup of old cells, which are called senescent cells. This impairs collagen production and leads to loss of firmness and sometimes wrinkles. So the scientists spent 5 years and they tested almost 1,000 peptides, and eventually they landed on the OS1 peptide. And it's proprietary. It's clinically proven to decrease the level of aged cells and reduce the age of the skin by several years. They did a third-party 12-week clinical study, and OS1 Face, the face cream that I have, was clinically proven to strengthen the skin barrier and significantly decrease visible signs of aging. So in particular, wrinkles were diminished in 87% of users. So that's pretty amazing. I haven't had a lot of wrinkles to start with, but I do notice that my skin feels firm, it looks nice, and I've been, outside in the sun, in the elements, and it's holding up really well this summer. So I think that OS1 probably has a lot to do with that. OneSkin is for everybody who wants to prevent or reverse the signs of aging with a groundbreaking approach. OneSkin addresses skin health at the molecular level, targeting root causes of aging so skin behaves, feels, and appears younger. So it's time for you to experience new skin health routine at a discounted rate. You can get 15% off with the code DUFF at oneskin.co. That's 15% off at oneskin.co with the code DUFF. Okay, so let's get into the second question now. This one reads, I recently left a relationship of 7 years. While we shared a powerful love for one another, we were not compatible with what we wanted in life. It was a very difficult time. However, we were on the same page about remaining amicable and friends. Immediately after I left, that changed. He began creating false stories and accusations about me, saying that I was living a double life and had been an online porn star for 10 years and threatening to ruin my life, photoshopping pictures, etc. In my opinion, he completely snapped. While I am hurt and angry, I'm also concerned for his well-being. I can't help but wonder if he went into some sort of psychotic meltdown. I'm terrified of him, yet I don't know what I can do to help him. I'm wondering if this type of situation sounds like a mental health breakdown and if I should try to help or walk away from my own well-being. I hope to hear from you. Thank you so much for all you do. Wow. Thank you for the question, and that's so terrible to hear. I'm really, really sorry that you've had to go through all this and are continuing to go through it. As a man, I'm so disappointed in your ex for acting this way. Behavior like this really adds to the understandable collective fear that many people have of men. And that may sound dramatic, but you don't have to go too far to find a story like this. We can really be monsters at times, and I'm sorry that you've been on this end of it. This is horrible and abusive behavior that you're enduring. Totally unfair. You should be allowed to make decisions about what you want to do with your life and your romance and relationships without fear of retaliation. It sounds like this type of behavior is totally surprising for you to come from him. It sounds like it doesn't fit with what you knew about his character beforehand. But just imagine if you did know, right? If you already knew that he could be this way, that he had this, anger and fire and vindictiveness in him, Would you stay or leave? And I think you need to realize, I say you to everybody, we need to realize that this is a position that a lot of people find themselves in, knowing that if they were to leave, they open themselves up to abusive behavior or even violence. And so they end up feeling coerced to stay. And that's so sad. It breaks my heart. You're clearly a very empathetic person. In the midst of such terrible behavior and you being a target, you find yourself concerned about him. And I can appreciate that. However, it's most important that you care for yourself first and consider his mental state second. In some cases, this could mean reaching out to people in his life, which I'll talk more about later, or even going to the extreme of talking to the authorities and getting something like an emergency protective order. An emergency protective order, or an EPO, is basically a fast-acting temporary restraining order that can prevent him from making contact with you, or at least cause there to be consequences for him making contact with you. So we'll talk more about kind of the things that you can do here, but I just want to clarify, you asked if he could have had some sort of psychotic meltdown, or what we might call a psychotic break. I suppose it's possible. People who do have a vulnerability to psychosis meaning things like delusions or hallucinations, in this case, it sounds like it would probably be delusional thoughts and beliefs about you. People who have a vulnerability to that, it's often activated by some sort of big traumatic event. So, a breakup, losing a loved one, getting fired from a job, actual physical thing like a car crash or something like that. Basically an activating event. But in this case, I'm not so sure. The fact that he's going out of his way to Photoshop pictures of you and intentionally crafting a false narrative makes me doubt that he just has delusional thoughts about you, right? Because he's making fake things. This seems to me like malicious behavior, and most people who have psychosis are not violent and are not malicious. There are exceptions, obviously, but for the most part, that's not what you would assume. So my best advice in a situation like this is to make sure that you have the support necessary to support your own mental health through this. You did nothing to cause or deserve this. This is abusive and inappropriate behavior that would be inappropriate to do to anyone, regardless of how long you've been in a romantic relationship or what sort of connection you have. You didn't mention in your question if you guys were married. I'm not sure. It doesn't sound like it, but if you are or were married, that can put a different spin on this. Just something to consider, because I've certainly seen people that get divorced and end up crafting false narratives about their ex so that they can portray them in a more negative light to the court. So, for instance, you might play up somebody's substance use, drinking, the way they are with kids, things like that, so that the court can view them in a more negative light in order to, take more from them. So if this could be the case for you, it would be very important to talk to a lawyer about this and figure out what your options are. But aside from that, as I already mentioned, you can talk to your local law enforcement about the situation and potentially get an emergency protective order if necessary and if they deem it appropriate. That would, kind of temporarily put a stop to these things and help you with the kind of planning and protection that you might need to do. But overall, I would highly suggest going completely no contact with him if you haven't already. That means blocking his phone number, email, social media, giving no access to you. And I would say that you are also free to announce broadly to those who know you, for instance, maybe on your personal social media or something like that, what's going on. And it doesn't have to be malicious on your part. You don't have to be trying to, harm his reputation necessarily. His behavior is going to do that on its own. But you could simply put out something saying, many of you know I was in a serious relationship for over 7 years. Since leaving this relationship, my ex has spread malicious and inappropriate lies about me. I ask that if you come across any of these lies on social media or the internet, please report them and do not engage with this content. Something like that, right? Just letting people know that there's stuff out there. So if they see something, it's not real, and to just report it and move on. I think that you should absolutely not try to help him or reach out in any way. Even though I don't think that you need to prioritize his well-being here, I think avoiding engagement is one way to help him even. It might be the best thing for him, right? Because essentially what you don't want to do is reinforce his abusive behavior with attention from you, right? If he knows that he can force you to interact with him by doing these things, that's just going to continue that behavior. So I would not do that. Of course, you're going to make your own decisions. This is just my perspective. But I don't blame you for being terrified of him. That's terrifying behavior. And the most important thing is to keep yourself safe. Don't keep it a secret. Talk to your family. And if you need to, talk to his family. This might seem a little scary or weird, like you're tattling on him or something, but you would be surprised at how little his family may know about his behavior, right? You might assume that, I don't know what the situation is, if he's close to his family or even knows them. But I know in a lot of cases, it seems like family would be in the loop, but they may be very much outside of it. So if you have contact information for one of his parents, for instance, you could send them a message saying like, I'm not sure if you're aware, but I recently ended my relationship with, let's call him Bob. I recently ended my relationship with Bob. I understand it's been very hard on him, and it hasn't been easy on me either, but I realized that our life paths are not compatible. However, since our relationship ended, he's been engaging in aggressive and inappropriate behavior. Specifically, he's told me he wants to ruin my life. He's accused me of living a double life, and he's made fake pornographic images of me. If you have any influence with him, I would ask that you please urge him to stop this behavior before I have to speak to the authorities. I'd also like your reassurance that I'm safe from any sort of physical retaliation because this is scary. Right? So just like throwing it out there. And with that, that's something that potentially could cause other people that know him to step in and start trying to get him help or, urge him to stop, whatever the case may be, so that you don't have to do that, because that's not something that you need to be doing. You need to keep yourself safe. And that's kind of all I have to say about this. This should not be happening. It's terrible that you have to deal with this. You did nothing wrong by deciding that you wanted something different out of life. And honestly, it seems like you made the right choice here, right? So keep yourself safe. Cut out all contact if you are willing to do that. Don't keep silent about what's going on. I hope that this fades in time, but please don't engage with him or try to save him. That's not going to work. That's just going to put you more at risk. But you can put other people on it, right? His family, authorities, mental health services in the area, whatever. You can do that, but you don't need to be the one reaching out and having that sort of contact. So watch out for yourself, keep yourself safe, and I hope that this ends soon. So with that, that's the end of the episode, everybody. Thank you so much for listening. This has been episode 362 of the Hardcore Self-Help Podcast. If you want to check out the show notes, go to duffthepsych.com/episode 362. If you would like to send me a question, shoot me an email to duffthepsych@gmail.com, and take good care of yourselves. I will see you for the next episode. Bye.